Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Today's episode, we're going to talk about the nervous system, neuroanatomy. Neuroanatomy is really a crucial component for the dental hygiene student to understand because it really helps you understand how the nervous system interacts with oral health. So we're just going to do like a simple breakdown of the nervous system and all of the components that are really important for the dental hygienist. So what I want you to think about, the nervous system is divided into two parts. The central nervous system, which is the brain and the spinal cord, and then the peripheral nervous system, which are the nerves that connect the central nervous system to the rest of the body. So the peripheral is all the outer, the periphery all goes out to the extension, and the central nervous system is like the hub, the middle piece, the brain and the spinal cord. The autonomic nervous system, the ANS, regulates the involuntary functions like things like saliva production and blood flow, especially to the mouth. So think about how this is all connected. You want to think about the big picture, the whole body and all the systems, but then you want to focus your attention on just the mouth so that you can really get down to the nitty-gritty of all of the different parts and pieces. So the primary reason when you are taking your pain management course, your local anesthesia course, the primary reason for you to really understand neuroanatomy is so that you can understand the cranial nerves and how they work and how they function so that you can properly anesthetize your patient. And there's really a few of the cranial nerves that are like the most important ones in dental hygiene, and that is cranial nerve number 5, the trigeminal nerve, cranial nerve number 7, the facial nerve, cranial nerve number 9, the glossopharyngeal nerve, and then cranial nerve number 12, the hypoglossal nerve. So cranial nerve number 5, it's the most important nerve for dental professionals. It pretty much controls sensations in the face and the mouth, helps with chewing, all of the things. And so when we talk about cranial nerve number 5, which is pretty extensive when you take your local anesthesia course, that one is the one that you are going to spend the most time on. And I have several episodes that cover the trigeminal nerve and study sheets on the trigeminal nerve on my Etsy store. So if you're having trouble with all the different branches and parts of the trigeminal nerve, I would suggest going there for additional resources. Cranial nerve number 7, the facial nerve, that controls all the muscles of facial expression and taste sensations. And again, I've covered this nerve in depth. So when we're talking about neuroanatomy and the cranial nerves, this is one of the most significant ones as well for you to understand. And when we think about providers out there doing Botox, the facial nerve is really important for you to understand not only the arteries, the veins, and the nerves all together, where they're located and what they innervate and their origin and insertion is for all of the muscles, and then what the nerves actually control. Super important for you to know all the details around that. And then cranial nerve number 9, the glossopharyngeal nerve, that helps with swallowing and saliva secretions. So think about all the parts and pieces to the action of swallowing and all the taste sensations and the feelings, right? Our tongue should be called a nose because it's super nosy. And in the field of dental, if you can keep the tongue happy and controlled, you're doing really well. So controlled during procedures and happy after procedures. So sometimes the tongue, it gets really involved in all the situations, as you know, in clinical. And so important for you to understand that cranial nerve number 9. If 9 is fine, everything is fine. So if you can keep the tongue fine, then you're doing okay. And then cranial nerve number 12, the hypoglossal nerve, that controls the tongue's movement, which is really essential for everything that I'm doing right now, speaking and swallowing. So hypoglossal nerve number 12. Number 12 is the one that really helps you do all of the functional parts of speech and swallowing. It's also important as a dental hygiene student to understand the pain pathways and some of the reflexes involved. So when you think about afferent, A, those are sensory, and efferent, E, those are motor pathways. And those help manage pain and recognize nerve-related dental conditions. So things like the jaw jerk reflex and gag reflex, those are controlled by neural circuits that the dental hygienist should definitely be aware of. And if you've taken radiology and you've taken an x-ray on a patient, you have experienced the gag reflex, I'm sure. So you can understand that that's a completely involuntary reflex that our patients experience. And then the other piece for neuroanatomy is that nerve damage can occur with our patients, viral, bacterial, some systemic issue. And those can express themselves in the clinical setting for us. So nerve damage, things like trigeminal neuralgia, Bell's palsy, those will significantly cause facial pain. So trigeminal neuralgia will cause the facial pain, and Bell's palsy will cause things like the dysfunction of one side of the face. And so those will show up in different ways for our patients. And we want to understand the connection and the causative facts that are associated with those conditions that our patients experience. And there are lots of resources online that will really help you take a deeper dive into some of these issues. But spend some time learning about the actual nervous system, the peripheral nervous system, the central nervous system, and then deep dive into how a neuron actually functions. Then get yourself focused around the specific cranial nerves. Obviously, you have to know all 12 of them. I have a couple of episodes that cover all of them and helpful ways to remember all of them and their function and whether or not they're afferent, motor, sensory, and then really dig into what are some of the clinical implications of these nerves and neuroanatomy specifically for the dental clinician, and how are those things going to show up in the clinical setting when I have a patient who has an issue or when I'm trying to use local anesthesia with a patient. How is this all connected? How do I connect the dots on care and translate theory into practice for my patient? So those are some of the broad spectrum things when it comes to neuroanatomy for your patient and for your clinical studies and didactic when you're doing local anesthesia. Hopefully this helps. I would definitely spend some time, scroll through all of the different podcast episodes so that you can really touch base. I cover all of these topics in great detail, whether it's neuroanatomy specific, the central nervous system, the autonomic nervous system, sympathetic, parasympathetic, those are all covered in great detail. So take a couple of moments to really scan through all of the different episodes that I have on my podcast, and whatever course you're currently in, write down those numbers that kind of connect you with the content so that when you have time, you're going for a walk, you can say, oh, yes, I was going to check out this episode on the podcast. Because while I do continue to record podcast episodes every week, so I try to be really intentional to not duplicate information. I might touch base on a different piece of content because the reality is I could record episodes every week for the rest of my life and really not cover everything that you have to learn in dental hygiene school. There's just so much information, guys. So what I would suggest is ways that you can utilize the podcast. And so if you are taking local anesthesia this summer or you're in a local anesthesia course, go through the podcast and look. I probably have 15 episodes that cover some bits and pieces and parts of local anesthesia, whether it's the cranial nerves, neuroanatomy, pain management techniques, different types of troubleshooting when it comes to local anesthesia, all of the different parts, the things that you learn when you take that course. I've covered some aspects of it. So take some time to scroll through. I know there's a lot of episodes at this point, but if you scroll through and jot down the episodes that you think will be helpful and beneficial to you in this current moment of wherever you are as a student or as a provider, I think it will help you support whatever struggle that you're having. And sometimes just hearing things in a different way will really support your learning. So that's all I have for this week. I hope you guys are having a fantastic week. Keep growing, keep doing, and keep moving in the right direction. I'll talk to you next week. Have a good one.